In this video, we show how an IP arthrodesis can be performed with a shark screw allograft. We open the joint with a Y-shaped skin incision. The incision is extended deep, proximally, to approximately 2 centimeters distal to the MCP1 joint. When dissecting, pay attention to the nail bed. After cutting the collateral ligaments, we remove the dorsal, lateral, and possibly the volar exophytes with a luer. We remove the cartilage with the luer, a sharp spoon, or the oscillating saw. Usually this is more successful if the IP joint is kept maximally flexed during this process. The arthrodesis should be performed in about 20 degrees of flexion. The exact position is agreed with the patient in advance. We then freshen the sclerotic bone of the 2 IP joint surfaces with the tip of a K-wire or a thin drill. We also check the rotation and whether the decartilated, refreshed joint surfaces lie flat on each other. Now we clamp a 1.6 mm K-wire coming from the proximal and drill the K-wire centrally into the shaft of the distal phalanx until the K-wire passes through the tip of the thumb. We check the position of the K-wire with intraoperative X-ray. Then we drill a central hole approximately 15 millimeters from the osteotomy for the later exit point of the K-wire. Starting from the joint, we now insert the 1.6 mm K-wire into the center of the trochlea of the proximal phalanx and drill it centrally through the shaft of the proximal phalanx until it exits approximately 15 to 18 millimeters from the IP joint through the dorsal cortex of the proximal phalanx, where the hole was previously drilled. Then we remove the 1.6 mm K-wire and insert a 1.2 mm K-wire into the resulting channels. To hold this position, we also place 2 1 mm K-wires. These allow all further steps to be performed without loss of position or rotation. Then the core hole is drilled from proximally over the K-wire and the thread is cut. Before this, we measure how deep the hole has to be drilled. To do this, we place the drill against the thumb so that the osteotomy gap is bridged by about 1.5 centimeters. In this case, we drill exactly 30 millimeters deep. We start with the thinnest drill, the blue one. Step by step, we approach the optimum diameter while drilling. When drilling and tapping, we make sure that there is a stable bone bridge of at least 10 millimeters between the entry point of the shark screw cut into the proximal phalanx and the IP joint. If the bone bridge is shorter, there is a risk that it will break through during drilling and tapping. We cut the thread with the help of the drill. The desired drilling depth can be seen on the laser markings on the side. After thread cutting, the canal is rinsed with physiological saline solution to flush out any fine bone chips that may result from thread cutting. In this case, we chose a 4 mm shark screw cut. Once the screw is screwed in deep enough, we saw off the protruding material of the shark screw with an oscillating saw on the bone surface. Then we mill the still slightly protruding graft bone back to the level of the surrounding bone surface. Post-operatively, we recommend a short finger plaster splint made of soft cast for 4 weeks. For another 2 weeks, the operated finger should not be loaded, and the healing process should be supported by occupational therapy.